A family in Lenasia, south of Johannesburg, is accusing the Tambo Memorial Hospital in Boksburg of negligence. 30-year-old Mndeni Khanyile, who was admitted to the facility last month, has disappeared without a trace. The family says their efforts to get answers have not been fruitful. Newzroom Afrika's Nqobile Madlala is following the story and joins us now live. A very good afternoon to you, Nqobile. What is the hospital saying for itself?
Good afternoon, Vio. Well, the hospital is not denying that Mndeni Khanyile was in here, but they're saying that there are a lot of details that we need to understand further, and that's why I have the CEO that's going to join us to give us those details. Acting CEO, if you can give us an idea, when he was here, Mndeni Khanyile, what really occurred?
All right. No, thank you very much, Nqobile. So the patient came in on the 28th of May at around 11:20 in the morning. He was from work, then was sent to us via the ambulance. Then was attended to our accident and emergency department by our specialist in accident emergency. All the investigations were done. It was further seen by the internal medicine department, which was more relevant department, because whenever a patient comes in the hospital, they start from accident and emergency, they are triaged, and then after that, once the basic investigations are done, the patient is then seen by a respective discipline, which was internal medicine. So after those investigations and further thorough examination by our clinicians, he was then observed overnight. And then in the morning, after observation, they realized that he was fully conscious, was fully well-orientated, and was fit for discharge. And this was done by the specialist in our hospital, in the accident and internal medicine departments. So after that, the nurses requested the patient to provide information of the person who had come and fetch the patient to go home. So let me just clarify that the patient was discharged, was not admitted, was discharged and observed. Patient did not go to the ward, was not admitted, but came in to be observed because of the condition he had. So after observation, after the clinician was satisfied about his condition and that he's fit to go back to work, was then discharged. Then the following events is that he then requested that the nurses or the hospital charge his phone. So the nurses then took the phone and charged it. But while they were charging the phone, he then decided to take the file because he was wearing his own clothes, not the hospital attire. He took the file and hid it under the jacket, and then he was seen from the CCTV footage, which was also, the access was also given to the family twice. So the family was given an opportunity to see the footage twice, and then he was seen, he assessed the environment because we have an entrance in the hospital in the accident emergency where there are securities. Every patient that is coming in passes through that entrance. And every patient after discharge or when they're going to the wards, they go through that entrance. So he saw that there were securities by the entrance. Then he decided to use other entrances, exits. He moved via our X-ray department and used the back door, which is not for patients, not even used by staff. Then he left the hospital. When he left, he went to the main gate. Securities told him that pedestrians are not allowed. Even if you are discharged, pedestrians don't leave the hospital via the main gate. So he decided to use the pedestrian gate and he left the hospital.
But one would think that the hospital is accountable for every patient that is here. One thinks that if you bring you bring a patient in the hospital, they're supposed to get help. And whilst they're being observed, they also watch that they're not doing something that is out of character. Why would a person who's getting help leave the hospital?
So at that time, because as I've mentioned, indeed you're correct. The patient did get help, was seen by doctors, treated, and then while at the time he was sitting in casualty, he was waiting for the family member to come fetch him. Under normal circumstances, a person, because he's 30 years old, so it's someone who can consent, who can take his own decision, and he was of a sound mind, So he had the right to leave the hospital on his own, Yeah. But in this case, while the nurses were charging his phone. He then took that opportunity and left the hospital. But it's not an abscondment. It's not a patient that was admitted. It's a patient that was discharged, awaiting the family member to come and fetch him.
So how have you then communicated with the family in terms of assisting them now to locate the patient, because he was ultimately last seen in your hospital?
Okay. So what we have done, we've met twice. Immediately after that event, we had what we call a redress meeting, where we call in a family and explain and attend to their concerns. So we met with the family, we explained that these are the sequence of events, and we as the hospital are willing to further investigate and find his whereabouts. In this point in time, we have involved the SAPS, we've opened a case of a missing person, we have further sat down twice with the family, and we've requested a consent from them so that we trace him internally and using all the other relevant stakeholders that we work with as a hospital. And they were appreciative of that. You know, they gave us, there's proof that we sat down on Tuesday with Mama and the other siblings, and they did sign and agreed that they appreciate the support they are receiving from the hospital. And we have engaged with other community centers to trace, the community centers where they keep homeless people. We've gone to that extent. We've used our own internal media platforms to trace him. And if you walk throughout the hospital, you'll see the plaque written a missing person with his face. And we did that after we had received a consent signed by the family that we can do that. Furthermore, we have opened up an opportunity to the family to come back to us, and we'll continue to give them feedback with all the progress. As I'm speaking with you currently, SAPS was here. They looked into the footage because we have a case number, and they will start the process of tracing their loved one. But we've also offered our counseling services because the family is quite aggrieved, and we truly understand that because our main function and the core business is to offer healthcare, is to give our patient dignity and respect. So we are continuously engaging with them. Even currently, we are with the family here in the hospital, still giving them opportunities to, ventilate their issues and concerns and see how best we can work together to find a solution and find Mndeni.
All right. And perhaps just as we close, what's going to happen now to the current family with regards to the psychosocial support?
So we have arranged counseling services via our psychologist. They are available at any given time. They're willing to come. Even right now, as I've said, we've said the psychologists are available to talk to them and engage until the issue is resolved. Because we know that it is a heavy issue. Losing someone you love who's a breadwinner, it's not an easy thing. And we also, as a hospital, take this very serious. We're not taking it lightly. Hence, we opened up all avenues and possible options that we can support the family until we find their loved one.
All right. Thank you very much for speaking to us. That is the acting CEO of Tambo Hospital. What he's explaining to us is, of course, what is taking place in the hospital, that there are details that they're currently looking at, how they can be able to assist the family, especially when it comes to psychosocial support. But they're not denying that Mndeni was here. In fact, we have ourselves seen the footage in terms of seeing what really occurred on that day. We have also reached out to the police to sort of look at the details around the investigation, and they said a missing person was reported to the police on the 29th of May. And they're saying that an investigating officer is in contact with the family as per records, and the last time they spoke to the family was on the 15th of June 2025. So, of course, we are going to continue to follow up what are the details and how far have they gone with the investigation at this point.
Nqobile Madlala with that update.